surgeon is joining us this morning. He's going to tackle ways to find relief from failed surgeries. We want to welcome Dr. Rod Paymon to Fox 11 News this morning. Dr. Rod Paymon is a board-certified spine surgeon who specializes in reconstructive cervical, thoracic, and lumbar spine. So thank you so much for being here again.
Thank you for having me.
This is an important topic. Unfortunately, some people have to go through this. So kind of talk to us about what is failed back surgery syndrome.
So failed back surgery syndrome is when a patient has undergone a lengthy spine surgical procedure either on the neck or the low back,
right,
and unfortunately their symptoms have not improved or have actually worsened as a result of the surgery, and so there's continued pain, continued nerve compression, continued numbness, tingling, and disability that remains.
So how often does this happen?
It happens. Thank goodness it's not extremely common. However,
right,
there is a subset of patients that are out there that are living with this type of disability and dysfunction and feel that they have no option. However, there
right,
are options for them.
And you know, it's unfortunate because these surgeries can be difficult. So what do you kind of do when you hit that kind of situation where you meet someone who just had surgery? What are their options going forward?
You know, every plan has to be custom tailored. So it's not necessarily that another surgery is the actual correct solution, right, for that person. So there's a number of non-surgical treatments, pain management procedures, injections that can at least lessen the pain, lessen the dysfunction, get them back on their feet. However, if these are not successful, then as mentioned, a custom tailored plan, depending on the specific problem that remains, is an appropriate solution for them.
So are those patients that are experiencing pain post-surgery, were they not qualified to go into surgery, or what kind of leads to this? You know,
I hope that's not the case.
Right.
However, to be honest with you, it sometimes the problem remains. Sometimes the nerve compression wasn't adequately removed, or sometimes, which is very common, scar tissue takes over and causes additional compression that may not have been there before the surgery. So again, the beauty of what we have now with MRIs, CT scans, X-rays, and interventional procedures allows us to really get an idea of what exactly is going on.
When is a spinal fusion the best option for treatment of a back or neck injury?
You know, spinal fusion has been used for decades here in the U.S. and abroad, and it's an excellent option when there's instability in the spine, or what we call spondylolisthesis. Okay. Long word, right, but it refers to instability of the spine. The second appropriate area to use a spinal fusion is when the discs of the spine, or the cushions or the shock absorbers, have completely worn out, right, and there's no shock absorber or cushion in the spine, and therefore that spinal segment needs to be stabilized. Traditionally, the only way to do that was with a spinal fusion. Again, with technology, we're lucky, there are other options. Spinal fusion involves screws, rods, a lengthy recovery, and again, it's appropriate in certain patients. However, we do have other options, including disc replacement technology now. And you brought a demo. What would you like to share with that? Well, this represents a spinal segment. So we have a bone here and a, right, bone here, so the spinal vertebrae. And this is the disc space. So this is where somebody moves, twists, turns. This is the front of the spine, the back of the spine, and the spinal cord runs down the middle. And this is what thins in between here, right? Correct. So this is what thins, and a lot of people, especially later in life, this disc is completely gone, so these bones are collapsed right onto each other. This newer technology, which we've been using for many, many years here in the U.S., is a disc replacement. Much like the knee replacement, much like the hip replacement, we now have a disc replacement in the spine. It's not appropriate for everyone. However, in the patient where they could benefit from this technology, it's excellent because, once again, we're preserving motion. There's no spinal fusion, and we're not eliminating anatomy. We're actually restoring a patient's anatomy and allowing them to move, hopefully in a pain-free way. Okay, so as we wrap up here, what would you like to say in summary to those who may need some kind of guidance if they're in this situation? In summary, I think there are many, many options for patients out there. So I think patients should be very hopeful and stay positive and never say that this is the end of the road and there's nothing out there for them, and consult with the appropriate specialist and see what's out there.
Perfect. Dr. Rod Paymon, his office is in Encino in the Los Angeles area. If they want to reach you, how can they get in contact with you? Your website?
The website, thespinemd.com, or call the office, which I believe the number's up there. So.
Okay, thespinemd.com. Dr. Rod Paymon, thank you so much for useful information.
Thank you.
We'll be back after a quick break.